Hello, I'm Etyene Schnurr, Scientific Advisor at Ceramics and Biological Dentistry Foundation. Biss stands for Bone Implant Stabilization System. In short, it was developed by Dr. Volz from SWISS Dental Solutions together with Professor Gahnaati from Frankfurt University. This system consists of different sizes of titanium mesh, for both bone regeneration and implant stabilization. The meshes can be bent, adapted according to the atrophy of the jaw, and then screwed in place for immobilization. Here in this picture, you can see two schematic drawings for Biss indication. On the left, severe atrophy with horizontal and vertical bone loss in the mandible, and on the right side, you see a situation like in premolar, upper premolar regions, where sometimes you have none of primary stability. The clinical relevance of Biss is because after tooth extraction, immediate implantation or any bone augmentation should apply to prevent atrophy. The tissues, the physiological response of the tissues, now useless, undergo a second wound healing to a forming scar on its ridge. The tension exerting in the marginal flaps will further lead to a closure of this cavity and atrophy. And the atrophy will worsen over time. Another clinical relevance is conform to the implant design to better prevent atrophy. It should have a coronal tulip form to mimic the natural teeth, the shape of the natural teeth, and this way support the soft tissue by preventing the marginal flaps collapse. Taking this, I decided to analyze the performance, the clinical performance of Biss using the SDS implants, because indeed it's preferable that these implants are placed on a tissue level situation, and at tissue level they are always placed supracrestally. The first study evaluated 19 patients. Those patients were operated by Dr. Rebecca Ruber from SWISS BIOHEALTH CLINIC. And according to the SWISS BIOHEALTH concept, surgery is only performed when the patients reach between 70 to 90 nanograms per ml of vitamin D plasma concentration, as well as LDL lower than 1 gram per liter. As you can see here in the two first quadrants. On the third quadrant, a very interesting result, although not significant. Male patients tend to receive more double amount of screws in this Biss in comparison to female patients. Nevertheless, the time necessary for healing was the same for both genders, and it was around 4 months. I separate one of these cases. So surgery was performed. We also respect the open healing concept. Here you see a PTFE membrane covering all as a physical protection. Under this is Biss overloaded with bone augmentation, PRF, as well as membrane collagen, and that undergoes here immediately X-ray after the surgery, showing the Biss in the correct position, screwed into the bone, and its immobilization. After 4 weeks, the PTFE membrane is removed. You see epithelialization progress over the mesh as the three-dimensional form is maintained. After, in this case, 6 months, the Biss is then removed. The area assessed, and you see clinical, very healthy bone aspect, as well as vascularized. This area received then immediately implants, 4 implants, reaching stability, and the healing caps. And this case is already followed for about 1.5 years. You see the X-ray showing bone formation, implant stability, as well as this implant in occlusion function, very nice and shiny. The second study that I separated for us was performed in 39 patients that received what we call floating implants. Those implants on the premolar regions, 1 or 2 implants, has no primary stability, and the stability comes from the Biss system. The gaps are also filled with bone augmentation and PRF following the period of healing period. After 4 months, then we tested for the stability using any check. For immediate or late implantation, there was no difference, statistic difference between them in regarding the stability reached after 4 months, and that was an average of 64 in the EST scale, defining a bone very safe for further restoration and occlusion function. So as a conclusion of those 2 studies, I can suggest that this is an alternative for bone regeneration and implant stabilization, but we also need to take into account the surgery procedure as well as the implant design. I thank you very much for your attention and see you next month.